Thank you for participating in the Texas Juvenile Justice Department's e-learning course. I will be narrating today's training on communicable diseases. Before we begin, please ensure you have downloaded the participant guide, as we will refer to it throughout the course. After you have printed your guide, advance to the next slide to continue. This e-learning course is provided as an alternative to a live training presentation. The Texas Juvenile Justice Training Academy does not guarantee that this option is in any way more or less suitable to prepare the trainee for the performance of their job duties. It is the sole responsibility of the employer to ensure that trainees are adequately prepared for the TJJD certification exam. Scenarios may be included. However, activities have been removed when interaction or engagement with others would be required. Scenarios, if used, are to evaluate comprehension of the material by the trainee and not intended to provide examples from the certification exam. Upon completion of viewing this e-learning course, the employer is responsible for completing any and all necessary documentation that the training on this mandatory topic was completed by the trainee. No certification will be generated after viewing this e-course. Thank you. Individuals are exposed to germs on a daily basis. Surfaces, air, and people's hands all may be infected with unseen bacteria. Most of us are aware of the daily measures we must take to ensure we do not infect others and ourselves with germs, like washing our hands after using the restroom, cleaning our hands after contact with raw meat, and covering our mouths while coughing. Let's listen to a story about John and Kathy. One day, John comes into work with a cold. As he reaches for the fridge handle to put his lunch inside, he sneezes. John uses a tissue to wipe his nose, but some germs got onto his hands, and he unknowingly contaminates the fridge handle as he closes the door. Unaware of John's cold, Kathy grabs the fridge handle and places her lunch inside. When she reaches her desk, she eats an apple, infecting herself with John's cold. Generally, sick people may come to work because they believe working through an illness is a sign of dedication, while others view their illness as a short-term issue, and others may simply have no sick leave available. In the workplace, one person with a minor illness may easily pass it on to coworkers or juveniles and their families. Minor ailments may seem harmless, but may negatively affect another person suffering from a more serious illness. As juvenile justice professionals, we will be in close proximity with juveniles on a daily basis. However, we may not always be aware if a juvenile has been diagnosed with an illness. Upon arrival to a juvenile detention center, juveniles are medically assessed to determine what, if any, medical care they will need while in custody. As part of their initial assessment, juveniles are tested for common communicable diseases, unless they refuse to in writing, which they have a right to do. If they are tested and a medical provider believes the testing must be repeated, it will be done with a written request. Regardless of the test results, a juvenile will be placed in an appropriate housing unit and will have access to services in a facility, just as any other juvenile would. Considering some juveniles may test positive for a disease while at a juvenile detention facility, certain individuals will be privy to this information, including medical staff, the Department of State Health Services, and if the juvenile is under 18, the parent or guardian. Aside from these parties, all medical information is confidential under federal law, outlined in the Health Insurance Portability and Accountability Act, HIPAA. So, there may be times when specific illnesses a juvenile may have are not disclosed. For this reason, it is critical to be aware of precautions you may take in an effort to keep employees, juveniles, and families we serve safe from the spread of diseases. Today, we will discuss some prevalent communicable diseases we may be exposed to while in the workplace. Preventative measures, often used to lower the transmission of germs, particularly in detention or residential facilities, will be explored. Finally, implemented policy and procedure used at local juvenile probation departments and facilities will be identified, in place to protect individuals from these common diseases. Let's take a moment to review the objectives for today's course. At the end of the course today, participants will be able to explain the relationship between communicable diseases and immunity, infection, and prevention. Describe the most common communicable diseases. And outline what employees must do to lower the risk of transmitting communicable diseases. A communicable or infectious disease is an illness caused by germs passing from one person to another. These germs spread via routes of transmission, which may be direct, requiring person-to-person contact, or indirect, where person-to-person contact is not necessary. Contact by direct transmission may occur in three ways, including casual contact, for example, a handshake; parent-to-child contact, for example, childbirth; and intimate contact, for example, intercourse. Indirect routes of transmission may occur by contaminated object, for example, a doorknob; bite or scratch of an animal or insect, for example, a mosquito bite; and contaminated source, for example, water. In your participant guide, turn to the activity titled Routes of Transmission. Take a few minutes to match the examples of transmission on the vertical column with the routes of transmission in the horizontal row at the top. The vertical examples may have more than one choice. We will discuss. We will reveal the answers. Please make any corrections if needed. For use razor, it's indirect and contaminated object. High five, direct and casual contact. Sneeze, direct, indirect, casual contact, contaminated object, and contaminated source. Tick, indirect and animal or insect. Blowing out candles on a cake, indirect and contaminated source. Intercourse, direct and intimate. Cafeteria buffet, indirect and contaminated source. Mole, indirect and animal or insect. Childbirth, direct and parent to child. Let's move on and talk about how the body fights germs and prevents illnesses. Immunity is the body's learned ability to resist infection. It is developed by fighting off an active infection successfully or vaccination. Typically, if the majority of the population has immunity to a disease, whether naturally or via vaccination, germs cannot cause an epidemic or widespread illness. However, if the population is not immune, a germ has the ability to pass through susceptible or vulnerable individuals. There may be times when a person's body is unable to fight off certain germs and they become infected with an illness. Even when practicing preventative measures to avoid the transmission of germs, there may be times when individuals become infected with those germs and become sick. Some illnesses may last a few days, others a lifetime. The time it takes an individual to recover from an illness, starting from the time of infection, determines if the illness is acute or chronic in nature. An acute illness, like the flu, lasts for a short time, typically for less than 3 months. Some people remain contagious after they have recovered from an acute illness. Therefore, preventative measures must remain the standard. If an illness lasts longer than 3 months, it becomes chronic. Oftentimes, individuals may feel they are recovering from an illness, but it may actually be lying dormant or showing no signs or symptoms in the body. For example, the chronic illness human immunodeficiency virus, HIV, may lay dormant in the body for years before symptoms manifest in individuals. There may be times when an illness initially appears acute in nature, but ultimately manifests as a chronic disease. Hepatitis C, for example, often begins as a short-term illness, however, without proper treatment may develop into a chronic, lifelong sickness, frequently leading to cirrhosis, liver cancer, or death. We will talk more about HIV and hepatitis in a few minutes. So far, we have talked about how germs are transmitted, ways to achieve immunity, and how individuals may become infected. Before we talk about what we may do to lower the spread of communicable diseases in the workplace, let's look at some common communicable diseases juveniles in our care may be diagnosed with. Juveniles in our care often have been diagnosed with some of the more prevalent communicable diseases. Knowing and understanding the signs and symptoms of these diseases aids in lowering their transmission and keeps you, fellow staff members, and other juveniles safe. Some of these prevalent diseases include influenza, flu, methicillin-resistant Staphylococcus aureus, MRSA, sexually transmitted infections, STIs, tuberculosis, TB, hepatitis A, B, and C, HIV, AIDS. We will talk about signs and symptoms of each of these, along with specific prevention strategies, beginning with the flu. A communicable disease most people know well is influenza, also known as the flu. It is a viral infection of the respiratory system, including the nose, chest, and lungs. The influenza virus is transmitted in the air via small drops of mucus. When a person sneezes or coughs, for example, germs are released into the immediate area surrounding them, and those most susceptible are then likely infected with the virus. Symptoms of the flu may include sneezing, congestion, runny nose, coughing, heavy chest, and wheezing. To prevent the spread of the influenza virus, remember to wash hands with soap regularly. Cover the nose and mouth when sneezing or coughing. Wear a mask around vulnerable individuals or those unable to fight infection. And receive an annual vaccination to avoid the anticipated strains of the flu, if desired. Let's move on and talk about another common communicable disease, MRSA. Methicillin-resistant Staphylococcus aureus, or MRSA, is an antibiotic-resistant bacterial infection which may cause serious infections in the circulatory and respiratory systems, often introduced by sharing personal items like razors or towels which have touched infected skin. People often believe a spider has bitten them when MRSA symptoms appear. Along with a small bump or infected area and fever, the area around the bump may appear red, swollen, warm to the touch, painful, and filled with pus or other drainage. A few preventative measures which may help with the prevention of MRSA include bandaging all wounds, abstaining from sharing towels or bedding, and disinfecting areas of possible contamination, for example, door handles. Another of the common communicable diseases juveniles are diagnosed with are STIs. Sexually transmitted infections, or STIs, are diseases transmitted via intimate physical contact. There are a wide variety of these infections categorized into 3 categories, including viral, bacterial, and parasitic. Today we will talk about 2 of the most common bacterial STIs juveniles are diagnosed with, gonorrhea and chlamydia. Both of these infections typically affect the reproductive organs and may cause serious health issues later in life. They are both treatable with medication. However, screening is critical, as symptoms may never manifest in some individuals. Gonorrhea symptoms may include pain or burning during urination, abnormal discharge, pain or discharge from the anus if infected, bleeding between periods, and pain, swelling, or tenderness of testicles. Symptoms for chlamydia may include symptoms similar to those of gonorrhea, in addition to lower abdominal pain and pain during intercourse. Both gonorrhea and chlamydia are transmitted via contact with bodily fluids such as semen, vaginal secretions, and mucous membranes like the mouth or eyes. The only sure way to prevent the spreading of either infection is to abstain from sexual activity. If this is not possible, precautions must be practiced if a risk of exposure to bodily fluids is possible. Let's turn our attention to tuberculosis. Tuberculosis, or TB, is a bacterial infection affecting the respiratory system, typically the lungs, although it may affect other areas. The disease spreads through small drops of mucus in the air and is treatable with specific antimicrobial medication. Symptoms of TB may include chronic cough, weight loss, loss of appetite, fatigue, and coughing up blood. Preventative measures which may lower the risk of transmitting TB include remaining in well-ventilated areas, properly using face masks in small enclosed spaces with those infected. Let's move on and talk about hepatitis. Hepatitis, considered an infection of the liver, manifests itself in 5 distinct viruses. Today we will discuss the most common, hepatitis A, B, and C. Symptoms of hepatitis, regardless of the type, include fatigue, loss of appetite, nausea, vomiting, abnormal pain, gray-colored fecal matter, joint pain, jaundice, or yellowing of the skin and eyes. Hepatitis A, an acute illness, is transmitted by eating something contaminated with small amounts of human waste. When an infected individual does not sufficiently wash their hands after using the restroom and then prepares food, those consuming that food may become infected. Preventative measures for hepatitis A include exercise proper hygiene, especially washing of hands, particularly during food preparation and after using the restroom. Receive a vaccination series if desired. Obtain a vaccination immediately after exposure, which may minimize the illness if desired. Hepatitis B, an acute or chronic illness, is typically transmitted through blood, semen, or other bodily fluids. When the disease becomes chronic, symptoms may subside, but the virus may still be present, causing damage to the liver, leading to liver scarring or cancer. Some ways to prevent hepatitis B include: receive vaccination immediately after exposure. Avoid unprotected sex with multiple partners. Receive a vaccination series if desired. Hepatitis C, also an acute or chronic illness, is blood-borne and is typically transmitted by sharing needles or other contaminated objects, such as cocaine straws used to inject drugs. While there is no available vaccine, some ways to prevent hepatitis C include: wash hands thoroughly, proper hygiene. Abstain from high-risk behaviors by avoid unprotected sex with multiple partners. Avoid sharing needles for tattooing, piercing, or drug use. And avoid sharing of drug paraphernalia. The last communicable disease we will talk about today is HIV. Human immunodeficiency virus, or HIV, is a chronic viral infection of the immune system. After an initial exposure, an individual may experience symptoms similar to the flu for up to 2 weeks. Subsequently, symptoms may not manifest for decades. Though fragile and unable to survive exposure to oxygen, the HIV virus is bloodborne and transmitted by sexual contact and use of contaminated objects like shared needles. Some ways to lower the risk of the HIV infection include abstaining from high-risk behaviors, using latex condoms during oral, anal, or vaginal sex, and sterilizing needles or syringes before use. The third phase of the HIV virus, when the infected cells in the body have become more numerous than the fighting white blood cells, is called acquired immune deficiency syndrome, or AIDS. Oftentimes, an individual does not die from AIDS, but rather from an AIDS-related illness, such as the flu, as the immune system is unable to protect adequately against minor infections. We have talked about various communicable diseases, their signs and symptoms, and preventative measures for each of them. Let's turn our attention to some preventative measures in place in the workplace we may use to prevent the spread of these communicable diseases. Local policy and procedure will outline ways necessary to lower the spread of communicable diseases in an effort to safeguard juveniles, their families, and employees. These implementations describe specific protocols which minimize exposure of germs, along with procedures to follow when exposed to possible contaminants. 2 of these practices, identified as standard and universal precautions, are ways in which we may lower the risk of germ transmission. While in the workplace, everyone has the responsibility to adhere to these protocols to reduce the risk of any individual becoming ill. Both standard and universal precautions are necessary when fighting germs. Standard precautions safeguard individuals from the spread of germs. Universal precautions are just as critical, particularly in the workplace, when there may be times when an individual encounters bodily fluids. Adhering to standard precautions reminds individuals about general steps necessary for proper personal hygiene and lowers the chances of becoming sick. Some standard precaution measures include washing hands per American Red Cross standards. If a staff member is exposed to a contaminated surface or object, he or she must wash his or her hands immediately, using the proper technique. If unable to wash hands immediately, an individual must use other methods to sanitize their hands until regular hand washing is possible. Let's take a moment to watch a video on the proper way to wash one's hands.
To appropriately wash your hands, first wet your hands and wrists under the running water. Keep your hands and wrists below the level of your elbow. Apply soap from the dispenser. Then, rub your hands together to work up a lather. Wash vigorously for at least 20 seconds. Pay particular attention to the following areas. Grasp, circle, and wash each wrist with the opposite hand. Wash the palms and backs of your hands. Wash the areas between your fingers. Rub your nails against the palms of your hands to clean underneath them. Rinse your hands and wrists under the running water, keeping your hands lower than your elbows and your fingertips down. Using a clean, dry paper towel, dry your hands starting at the fingertips, moving back toward the elbow. Drying your hands thoroughly keeps them from becoming chapped. Discard the paper towel in a facility-approved waste container. Use another clean, dry paper towel to turn off the faucet, and discard the paper towel in a facility-approved waste container. Use a clean paper towel to cover the handle before opening the door. If the door does not have a handle, push the door open with your hip and shoulder to exit. As an alternative to washing with soap and water, you may use an alcohol-based hand sanitizer. After using an alcohol-based hand sanitizer, wash your hands with soap and water as soon as possible.
Hand washing is one of the easiest and most effective ways to control the transmission of dangerous germs. Let's continue the discussion on standard precautions. Dispose of used needles, sharps, or contaminated items appropriately. Employees must place found needles and sharps in a rigid, closable, puncture-resistant, leak-proof, and biohazard labeled or color-coded container and take the contained sharps to the medical or infirmary area for proper disposal. Further, juveniles and employees must not handle contaminated broken glass or other objects. Any contaminated items found must be reported to appropriate personnel for cleanup. Prohibit juveniles from sharing disposable or battery-operated razors. Though razors are not considered a biohazard when disposed of, they should be stored away from juveniles until they are allowed to use them. Be sure to closely monitor the use of razors and ensure juveniles are not sharing them. Follow local policy and procedure with regard to when, where, and how long a juvenile may use a razor. Use personal protective clothing and equipment, PPE. If an employee must handle contaminated equipment or clean a spill, he or she must use personal protective clothing and equipment or PPE. This protective equipment must be fluid resistant to blood or other potentially infectious material, meaning infectious material must not be able to pass through the employee's clothing and reach the skin, eyes, mouth, or other mucous membranes. Dispose of used PPE properly. Follow local policy and procedure regarding how to dispose of PPE properly. Any contaminated equipment must be cleaned properly, according to local standards. Equipment visibly soiled with any bodily fluids must be cleaned with cleaning materials provided at the local probation department or facility and by proper personnel. Taking universal precautions is different from standard protocols in that all bodily fluids are assumed infectious and are handled as such. These precautions are necessary because some people may not appear ill when they are, or may not show symptoms of illness when they are sick. In addition, as mentioned earlier, due to federal statute, Juvenile medical records are confidential, and it may not always be known if a juvenile has been diagnosed with an illness. Be mindful of local protocols with regard to handling body fluids. Even with policies, standards, precautions, and universal precautions in place regarding communicable diseases, there may be individuals who do not comply. Let's talk about what may happen if these measures are not followed. There are several ways failing to follow policy and procedure with regard to preventing communicable diseases may affect the workplace, including risks of infection, transmission of illness to juveniles, other individuals, missed work, professional liability, disciplinary action, and increased healthcare costs. Remember, address minor incidents immediately to prevent larger issues. Maintain personal hygiene and clean, sanitary workplace conditions. Follow all procedures using standard and universal precautions. The last thing we will talk about today are reporting requirements. According to your local department or facility, there will be certain protocols you must follow if you or a juvenile are exposed to bodily fluids. When a juvenile or a staff member are exposed to bodily fluids in a juvenile detention or residential facility, certain procedures must be followed, particularly when reporting the incident. If juveniles are exposed to bodily fluids, either from another juvenile or staff member, the following procedures outlined in a department or facility's health service plan developed in conjunction with the local health service authority must be followed. Medical personnel must be contacted. Supervisor must be informed of incident. Pertinent documentation thoroughly detailing incident dictated by local policy and procedure, and other juveniles must be kept safe and secure from potential exposure. Further, according to the Texas Administrative Code, Chapter 343, if a juvenile must be medically isolated because of an illness or exposure, documentation must be completed and placed in the juvenile file, and he or she must be seen by a medical professional no later than 12 hours from the initial isolation. Medical isolation may only be authorized by a facility administrator or healthcare professional, and the 12-hour requirement applies when a facility administrator places a juvenile on medical isolation. A JSO must monitor the juvenile during the medical isolation at random moments, no more than 15 minutes apart. A juvenile may only be cleared from medical isolation by a healthcare professional. If an employee is exposed to bodily fluids from a juvenile or another employee, he or she must follow local policy and procedure. Recommended protocols to follow include: report to facility administrator, supervisor, and or other parties as noted by local departments or facilities immediately. Thoroughly complete paperwork detailing the incident dictated by local policy and procedure. Seek professional medical advice regarding all options available after exposure, which may lower the risk of contracting a disease. An employee must follow local guidelines with respect to returning to work after an exposure, including documentation clearing him or her to return to work by a medical professional, along with how to seek workers' compensation if applicable. These recommendations are suggestions. An employee must adhere to local policy and procedure regarding a potential exposure. Employees must also be aware of what to do if they have been or are diagnosed with a specific illness. For example, if a staff member is HIV positive, he or she is not required to disclose this to the local juvenile probation department or facility. However, if he or she so chooses to disclose the information, the department or facility is bound under the Americans with Disabilities Act, or ADA, which provides protection against any potential discrimination. For additional information or questions regarding a personal medical situation, contact your local human resource representative. In addition, the Texas Administrative Code, Chapter 343 and 355 outlines specific policies related to communicable diseases in secure pre- and post-adjudication facilities. Further, local policy and procedure may outline additional requirements, which must be adhered to as well. We have come to the end of the course today. Let me leave you with some final thoughts. We have talked about communicable diseases today, including those most prevalent among juveniles we serve, symptoms, preventative measures, and the detriment of not following proactive measures necessary in lowering the spread of communicable diseases. Some final thoughts to keep in mind. Prevention of communicable diseases is the responsibility of everyone. Using standard and universal precautions at all times keeps juveniles, their families, and staff members safe. Follow all policies and procedures. Report any possible exposure immediately, and follow up with a medical professional as soon as possible. Thank you for attending the Communicable Diseases course today.